probably I could come up over the last 20 years with a number of stories. The one that popped into my head was about an 11-year-old kid that I saw up in Amarillo, Texas. That he had been sent from one of the rural farming towns some distance away. He'd been seen at their hospital, seen in their emergency department, and they weren't sure what was going on with him. The chief complaint, according to his mother, was that he just couldn't keep anything down. Anything he ate, he vomited. I started getting a sense that something was really wrong. I looked over, and he was a pretty big kid, probably 180-pound, 11-year-old kid, like a, kind of like a football player, but he was still, and he wasn't moving. But as I was looking at him, I was seeing something, and it wasn't quite clicking at first. But I looked and noticed that his pulse oximetry was a little bit low. And he kind of looked a little bit puffy to me. And on my physical exam, I'm kind of thinking, this is a little bit odd. I'm hearing noise in his chest, what we call rouse. So there's water, there's fluid in his lungs. And I look at his hands and his feet, and I'm seeing edema. He's retaining water. And I was scratching my head because what I was seeing was an adult disease in an 11-year-old kid. So I ordered some labs and did a chest x-ray and probably went back to him 1 or 2 times to go look for some more physical signs as I started catching on to this. So he got back from x-ray, and as I expected, he had an enlarged heart and his chest was full of fluid. One of the pediatricians, intensivists who worked in the ICU called me, and he said, I just saw the echo of your kid with the heart. I've already made communication with Children's Hospital in Dallas, and we're going to be flying him down there. This young man ended up having a long course, and he needed to see if his cardiomyopathy, a big swollen heart for a reason that we're not sure of, was going to resolve, or if he was going to need to be on the heart transplant list. And then I treated him. I treated him like an adult who had congestive heart failure, and helped get some fluid off, and he was feeling much better by the time he left. He was able to get into the system, and he'll be, a long road, but he'll be okay. He'll get a second chance.